Okay, this is Lauren and Julia presenting on cochlear implants in children. A cochlear implant is a device that provides direct electrical stimulation to the auditory nerve, which is located in the inner ear. Cochlear implants have external and internal parts that work together to allow the user to perceive sound. The best candidates for cochlear implants are children with profound hearing loss in both ears, children who have limited benefit from hearing aids, children who have no medical conditions that would make the surgery risky, children and/or parents who are willing to be actively involved in their habilitation and rehabilitation, and children who have support from their educational program to emphasize the development of auditory skills. The SLP's role in the implant process. Speech-language pathologists, along with audiologists, provide oral rehabilitation services to implant recipients. Oral rehabilitation may consist of services to enhance communication, auditory training, and speech reading, training on the use of care of the implant, and support the needs of the recipient and their family.
Okay, so then we looked at some language characteristics of children who have cochlear implants. And for this, we looked at some of the research. And the research that we looked at stated that children with cochlear implants had more rapid rates of development in language growth when they were implanted at earlier ages. And this makes sense because that's when they're starting to develop language and when their brain most readily masters language. So according to this research, it found that if children were implanted before they were 18 months of age, that spoken language appeared to emerge most naturally. And that's because if they were implanted before the 18 months, they weren't very far behind from other children our age, since we don't really have too much language before the age of 12 months. And then it said that if they were implanted after 18 months, existing auditory delays may still be present. So basically what that means is that if they already had any auditory delays because they weren't able to hear and they were already behind or anything like that, that usually carried back over to when they got their cochlear implant as well. So the research suggests that although there is greater benefit from a cochlear implant compared with traditional hearing aids, existing auditory delays at the time of implantation present continued educational and rehabilitation challenges that oftentimes cannot be overcome. So the research also, not from the same research, stated that communicating with a child before a cochlear implant, so either through spoken language or sign language, could help set a foundation for easier time developing spoken language. And then we also found that as far as the deficits were concerned, there's usually a delay in the area of phonological awareness in comparison to normal hearing peers. So we looked at another study for this one, and the study was conducted on 24 children who had cochlear implants and 23 normal hearing children to determine whether preschool age children with cochlear implants have age-appropriate phonological awareness and print knowledge. And from this study, the results found that the children with cochlear implants have the ability to develop age-appropriate early literacy skills by preschool, but that intervention programs should target phonological awareness. They also found that there's a need that we need to help by identifying and interpreting new sounds, and we need to help for imitating and detecting sounds as well. So we have a short YouTube video with a speech-language pathologist working on these.
Good. Let's do this one. Ready? Good. Can I have the donut? Ooh. No. Try again. Ooh. Here you go. That's the Try this one, Alexander. Ooh. Good. Ooh. And this is the E.
Okay. Okay, so one of the things that Julia and I found that we thought was really helpful was from the Medel website, which is one of the cochlear implant brands. They had a whole link to kid-friendly resources for children. And it just provides, like it says on the PowerPoint, it provides short PowerPoints in kid-friendly terms to help them understand what they will face with a cochlear implant. So we found that a couple of these were really helpful to explain to children or even adults, like things like what is a cochlear implant and what is life like with a cochlear implant, so that children have an idea. So we just wanted to play them. They're really short, but just so you know, you can get an idea of how maybe speech language pathologists can talk to children about cochlear implants. Oh, actually. So I'll just leave this up here for you to read for a second, and I'll just go through each slide. And as you can see, it's in pretty like kid-friendly terms. Some music and some fun pictures. See, they're very short. We also like this last one too. All right. Okay, so then
Moving on to assessment and intervention for children with cochlear implants. Newborn hearing screenings take place before the child leaves the hospital or by 1 month of age. If they do fail the screening, they follow up with an audiologist by 3 months of age. And if there is then a confirmed loss, they start receiving intervention by 6 months of age. Speech language pathologists begin seeing infants when they're 3 months old, if they're in the process of a hearing aid trial, and they start seeing them by 1 year of age if they received a cochlear implant. Audiologists that do most of the assessment initially, but SLPs are needed to help reinforce instructions, encourage the family, and provide support. So yes, SLPs make sure that the follow-ups and diagnostics are given to children who fail their screenings. Speech language pathologists need to address device compliance and make sure the parents know how important the using the device is for the child. They need to make sure the parents know that they have communication choices such as hearing aids, cochlear implants, and learning American Sign Language or another form of sign language. And they can address genetic testing and talk to the parents about getting their child tested to find out if the loss is genetic, which might be helpful then in planning therapy and treatment. And speech language pathologists are needed to support and listen to parents who are coping with their children's hearing loss, so be a counselor.
Okay, so we had 2 videos that we thought were very cute. 2 children who got a cochlear implant, and this showed the activation of the cochlear implant for the first time. So let's see. The first video is just an 8-month-old baby's reaction to his cochlear implant. So we'll just play this one first.
And he's back on again. See how he turns?
Hi, Jonathan. Stop the sucking. Hi. Good. Did you hear that? Hi, sweetie. Could Did you hear that? Hi. Hi.
You got that, Dad, right? Mm-hmm.
Hi, Jonathan. Hi.
We call that a late Christmas present.
Hi. Good job, buddy.
That's really good. We go.
Alright, and then the second video that we have is of this little girl. According to the little blurb underneath that her parents wrote, she's 4 years old and she just got a cochlear implant. Her parents said that she passed her newborn hearing screening, but then as she got older, they started noticing that her speech wasn't developing as quickly as other kids her age. So they had her hearing tested before she turned 3, and that's when they had found out that she had a profound hearing loss in one ear and a severe to mild hearing loss in the other ear. So she was aided in one ear, and then she was progressing in speech therapy for 9 months. And then a few months later, well, I mean, they gave the date in 2009, but she had lost the rest of her hearing. So they finally got the cochlear implant, but they had no explanation as to why she had the hearing loss. They looked at genetics and everything, but they couldn't find, you know, where her hearing loss had come from. So we'll just play a short clip of this one.
Hey, Allie.
You hear it?
You here, baby?
Are you okay? Because I can't see your
Hey,
nose.
She's got us just, oh my gosh. Hey, darling.
You okay?
What is it? You hear it?
Yeah.
You hear it?
Don't you get upset, though.
You hear it?
Can you hear us? Can you hear yourself?
What is it?
We have to turn it off. Let's see. Now we'll turn it back on. Just make sure you see it.
She looks.
Go ahead.
She see that look and it's like, oh, what's wrong?
What happened?
Allie, did you hear it? Sorry, she thinks that thing is coming her ear.
Can you hear it, baby?
What is it, baby?
I don't use a loud sound. She's hearing it, obviously. She's hearing it. But she didn't turn around because she doesn't quite,
It's not
yeah. And
registered.
to be honest, I don't know if both ears are balanced. I mean, I'm trying to get them as best I
Right.
can, but that's an even bigger skills trying to get kids to make sure that they're even. But we're going to work on all that. Because she didn't have hair in her right ear. It's probably, right, it's probably a little bit different. It's probably not quite as picking it up, but it's gonna be good.
Okay. Okay, so finally to wrap up our presentation, we had a cochlear implant simulation that we wanted the class to be involved in. And so let me see what this will let me pull up. Basically what this is no one's exactly sure because it changes from person to person what a cochlear implant sounds like for each person. But this kind of simulates maybe what a cochlear implant would sound like for someone compared to a normal hearing person. So we thought it would be a good idea to give the class just some examples of what they might be listening to.
And get their opinions on what they heard or what their
What they think they're hearing.
exactly their initial reaction.
So let's see. So that was one example, and that was the phrase, "We are the charity taking action on hearing loss." But that was like a cochlear implant that was a little bit older. So now this would be an example of a modern day cochlear implant. And
We are the charity taking action on hearing loss.
And we would probably play that a couple times for the class and see if anyone understood any of the words that were being said. And the same thing for the audio. Let me see, we'll do this one. Because for music, you would think it would sound similar, but it's a pretty big difference with a cochlear implant. So give me 1 second to pull this up. Okay, I'm not going to make you listen to all of that, but it also showed what it would sound like with a modern day. And then we had one other website of simulations. They're a little bit different. It played what the real song would sound like or what the real person speaking sounded like, but you get the idea with this one. So when this next one pulls up, we'll just not do the last one. Alright, so that one's a little more clear that it's music playing compared to the one before it. But basically, like I said, we were just going to have the class listen to different sentences, listen to different music, and see if they could understand anything that was being said, and just to get an idea of what a cochlear implant's really like.
So we'll pull up our references for you real quick, and also we will send you our handout and a copy of the PowerPoint slides. Thank you.
Have a nice break!